Today we're going to do a perio charting of your mouth, and we're going to see how healthy your gum lines are and be sure that they're in health. This little laminate will help us do this. In health, we're going to take a little probe, and it's going to go in between the tooth and the tissue. We want it to stay between 1 to 3 millimeters. And we'll do this from the cheek side and from the tongue side. So we'll be taking 6 measurements on each tooth. In health, the tissue looks nice and coral pink. There's no bleeding. And we look over here at an x-ray, and there's no bone loss. Everything is up around the necks of the teeth. In gingivitis, we'll step down to the next progression here. This person has not brushed maybe or flossed as often as we would like. And when we probe, we're going to get a little bit of bleeding. We're still going to be with 1 to 3 millimeters with our probe, but there's definitely an infection. Inflammation has started. And we'll look over here, and we still have no bone loss. It's still pretty nice up around the necks of the teeth. If we let this go untreated and we don't get them cleaned off and we don't start taking care of them, it can progress into early periodontitis, and our probe depth could go down to 4 millimeters. What happens is it gets deeper. We can't get to the base of that pocket with our floss and with our floss and our toothbrush. But the bacteria can get down in there. It's anaerobic bacteria, so it'll keep growing and living and having a little infection process, and that's where we're seeing this inflammation. Look at this picture here, and you can see there is inflammation. There's a little bit of swelling of the gum lines. They're a little bit red, and we'll definitely get some bleeding when we do our probing. We'll look at the x-rays over here, and there is a little bit of bone loss. You can see it's kind of fuzzy on the tops. It's not nice and straight across like the one above it. If we let this go untreated, the 4 millimeter pocket that we can't get to the base of, the bacteria will still stay down in there and keep progressing, having a good old time in advancing itself. It'll actually go 4 to 6 millimeters. And you can see here that this yellow stuff is the bone. It has invaded the bone. We're getting more bone loss here. It's gone from the inflammation to the tissue to the bone. And you can kind of look here again. We have the puffiness of the tissue and redness and bleeding. I look at the x-ray, and we can really see how the bone loss has gone down out on an angle here. And that bone is gone. We'll never be able to get it back. And we let that untreated, and it just keeps progressing more and more, and we get down to over 6 millimeters worth of our pocket depth. And we've really lost a lot of bone loss, and you can look over by the x-ray here. You can even see this is the root of a tooth, and this is what we call furcation, and we've even lost bone in between the root of that tooth, and likewise in between the teeth. A lot of times you'll see mobility or movement of those teeth. You might have a bad taste. Some exudate might come out of that, and that is advanced periodontitis, where you could end up losing some of your teeth. Is there any questions or anything that you'd like to have cleared up? Where would you think that you would fall if you were, before we do our perio chart, where would you think you would fall, your mouth?
Probably between these two.
I hope so, between 1 to 3 millimeters with no bleeding, and the bleeding would indicate that there was an infection or some bacteria down in there that we haven't been able to get out. So you can listen as we go along, and we want to stay within 1 to 3 millimeters. But if you were to fall in between one of these, don't worry about it. We can take care of things, and that's my specialty here. We can get that all cleaned out and get you back to health.